In this video, you are going to learn how to use a defibrillator in the event of someone suffering a cardiac arrest. If the person does not respond to you when you speak to them, whilst holding their hand and gently shaking their shoulders, call for help if you're alone, and lay them on their back. Check their breathing by placing one hand on their forehead and the fingers of the other hand under the tip of their chin. Carefully tilt their head backwards and lift their chin so as to fully open their airways. If you see or hear no respiratory movements, nor feel any breath in your cheek, then the casualty is not breathing. Call the emergency services. Ask someone else present at the scene to bring a defibrillator. While awaiting the emergency services, expose the casualty's chest and begin chest compressions by pressing down on the center of their chest at a rate of 2 per second. If you're alone, do not perform any chest compressions, but go and find a defibrillator if there is one nearby. Once the defibrillator has been brought to the casualty, turn it on and follow the instructions that it gives, or that come with it. Take out the electrode paddles from their packaging, remove their protective film, and place each electrode as illustrated in the diagram, included on the packaging or on the electrode itself. Make sure that nobody is in contact with the casualty while the defibrillator is analyzing the casualty's heart rhythm. Follow the instructions of the device, which will indicate whether you should administer a shock or continue with chest compressions. Continue in this way until the emergency services can take over, or until the casualty begins breathing normally again. This device can even be used on children and infants, normally with a special adapter or using pediatric electrodes. If the absence of these adapters or special electrodes, an adult defibrillator can be used. Place one electrode on the chest and the other on the back at the level of the chest.